Hello, and welcome to today's webinar, The Role of Hypochlorous Acid in Wound Healing, Puracyn Plus. This webinar is part of the WoundSource Wound Care Product Navigator series. The Wound Care Product Navigator series is an easy-to-access, interactive learning lab for the healthcare professionals to get the latest information they need on the wound care products available to them. Each webinar segment will take a deep dive into a specific product technology. Our sponsor for this installment is Untitled Inc. My name is Amy McCauley from WoundSource, and I will be the moderator for this event. This program will provide an in-depth look into Untitled hypochlorous acid-based wound cleanser, providing information on the benefits of hypochlorous acid, product indications, and case studies. This presentation will be followed by a question and answer session, so we encourage you to submit your questions to us throughout the program. As a reminder, the content of today's webinar is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, nor is it intended to be a substitute for manufacturer instructions. Always refer to your facility protocol in the assessment and treatment of patients. The views and opinions expressed in this program are solely those of the presenters and do not represent the views of WoundSource, Kestrel Health Information, Inc., its affiliates, or subsidiary companies. Now I want to take a moment and provide you with an overview of your webinar console. At the bottom of your console are application tools that you can use during the webinar. To submit a question to our guest speaker, please select the Q&A app icon on your screen and type your question in the field provided and select Submit. We will try to get to all of your questions during the question and answer period. You can expand your slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. If you have any technical difficulties during the program, please click on the Help icon, which is the app with the question mark icon. This covers the most common technical issues. To access information about today's guest speaker, you may select and expand the Bio app found on the left-hand side of your console. Our sponsors have included additional information on today's product. On the right of your console, you will find a list of resources available for download. You may also access this information by selecting the document icon in the bottom tray of your console. This webinar is being recorded and will be made available on demand. If you have any other requests or questions pertaining to this program, please contact our sponsor using the Contact Us app located in the tray of your console, which is the application with the email icon. Now, before I introduce today's guest, please take a moment to complete our quick poll, which should display on your screen here momentarily, to help us find out how many have joined us for today's session. The question is, how many people, in addition to yourself, are watching the webinar with you today? If you are attending this webinar by yourself, simply enter a 0. If you are in an in-service setting, an estimate is fine, and we thank you for your response. At this point, I want to welcome our featured speaker, Michelle Moore. Michelle is the Senior Director of Clinical Affairs for Untitled and has specialized in wound care for 29 years. She has assisted in the design and development of many wound care products and is an experienced speaker and educator. Michelle, thank you so much for joining us today. The floor is yours.
Hello, you guys. Happy Friday to you. Thank you all for joining in on today's spotlight on Puracyn Plus and the hypochlorous technology. Let's first begin with a little bit about our company. Untitled, the makers of Puracyn Plus, is a family-owned and operated company based in Southern California. For over 10 years, we have designed and developed skin and wound care products for use in the healthcare market. From the research to the final products, Untitled brings you exceptional products that impact the healing process of your patients. Our commitment in the wound care market reaches beyond the bedside to bring hypochlorous technology to those that need it most. We support many organizations, those that work with disaster relief, those that are less fortunate, and those that otherwise would not receive the best treatment. A snapshot of our line shows many configurations. Don't let the amount of choices overwhelm you. We have 2 types of hypochlorous products, a liquid and an antimicrobial hydrogel. Our liquid bottles are designed specifically for the needs of the industry, from bottles that allow you to spike for use with negative pressure or debridement, to large bottles for surgical irrigation and flush, and even small single-use bottles. We have a configuration for your facility's needs. Puracyn Plus antimicrobial hydrogel is in a 3-ounce size. It's compatible with the HCPCS codes for reimbursement. So when you see our breadth of products, understand it's thick or thin, liquid or gel, and really what need you have for your patient mix. So let's get into where you would utilize Puracyn Plus. Oops. Hang on, you guys. Gotta be smarter than the computer here. Let's get into where you would utilize Puracyn Plus. Puracyn Plus is indicated for cleansing, irrigating, moistening, and even debridement, key areas that can assist with the initial barriers to wound healing. When we talk about wound healing, we need to start at step 1, and for step 1 for me is wound bed prep. So with wound bed prep, oh, something's happening, you guys. So with wound bed prep, it's all prep in the bed. Wounds don't heal when the bed hasn't been prepared correctly. So we need to look at making sure that we're picking the right products for the patient and preparing that wound bed. So you have many choices, and all of them are appropriate in some different capacity. But so let's get into it. You have saline, which basically gets tissue wet. You have surfactant-based cleansers that gets tissue wet and help move around debris. And then you have those aggressive cleansers, the povoiodine, the Dakins, the chlorhexidine that gets tissue wet, removes debris, can be an antimicrobial or aggressive against a bioburden, but they are also cytotoxic to the tissue that you're trying to grow or protect. So we need to look at products that can do all that without harming healthy tissue. We need to make sure that we're picking the right products here. When we talk about wound bed prep and actually cleansing the bed, it's not a squirt, squirt, and move on. This is where you can actually make the right choice to prepare the wound bed to take on those more advanced products that you're using on top of it and getting that wound bed to heal out in a quick and orderly fashion. It's looking at the wound bed, what may need to be addressed, whether it's necrotic tissue in the bed, a poor moisture balance, infection, or bioburden. Is the cleansing agent that you're using setting the stage for your wound bed to heal out, or are you starting with a product that isn't addressing those needs? So that's where Hypochlorous comes in. And it's shifting the focus from those traditional types of wound cleansers and wound prep to actually incorporating a product that on the first step in your wound healing process that you're making a difference on that wound bed and putting in a hypochlorous molecule. It is a new shift into the wound care. It answers many of the challenges in wound bed prep and the processes needed for wounds to heal. So what is hypochlorous? And let's get into what really it is. So hypochlorous is not new. That molecule is actually part of your own immune system. It's part of the respiratory burst that occurs inside your body. And inside your body, that tough molecule is extremely aggressive in being an antimicrobial, antiviral product. It was the challenge of getting that molecule to remain stable outside of the body. And that's what makes it new into the wound care world, is being able to take that molecule, keeping it stable, and putting it into product. And that's what we did. We stabilized that product, put it in a buffered system, and bring it into product that you would use for your patient mix. So what it does inside the bed is exciting. What it does inside the body is exciting. So some of the benefits of hypochlorous is that hypochlorous itself has a high kill rate on bacteria, viral, yeast, even spore. In the presence of hypochlorous, those molecules do not like it and die out in about 15 seconds. More so longer period of time for spores, but those VRE, MRSA, and E. coli die out in about 15 seconds in the presence of hypochlorous, which is an aggressive and rapid response. But remember, it doesn't harm healthy tissue. So that ability to take care of your wound bed on a surface level by incorporating just a standard hypochlorous liquid is amazing as far as what it does to the wound bed. Other benefits of using hypochlorous is that, again, it's not cytotoxic. Because you make it, you actually have no stinging, no burning. It doesn't contain alcohol or an iodine. It doesn't have antibiotics or steroids where you could have a problem with your patient. One of the things I want you guys to remember is because it takes care of bacteria in the wound bed, it will also decrease the odor in the wound bed. We all know that wounds have odor because you have bacteria that releases ammonia and sulfur. And when you can take that bacteria away, that ammonia and sulfur byproduct also gets removed, so your wound bed doesn't smell. You don't have to rinse it. You're not diluting it. There's no special requirements on handling. It has a very long shelf life, and it plays nice with other products. So when you've prepped the bed and prepared it, you can actually feel safe knowing that you can use those more advanced wound care products, and it's actually going to do its job. The bed has been prepared, and you can use those more advanced products with no interaction amongst each other. You can use it for irrigation. You can actually saturate gauze and use it for a wet to moist. You can saturate skin grafts for application and have a stronger take. The hydrogel actually is indicated for relieving of itch and pain associated with dermal irritation. So the many benefits of hypochlorous, there's many of them that you come in contact as a challenge when you're dealing with wound care and wound prep. So we have some pop-up questions. And what is the most common wound irrigation product that you currently use? We just want to know. And there's no wrong answer because there's a place for all of them. So where would you use hypochlorous? Where would you use Puracyn Plus as far as indications? And the answer is you can use it anywhere. Indications for use is for acute and chronic wounds, partial and full thickness, burns, first and second degree, diabetic ulcers, venous, arterial. There's no wrong place for it. You can use it when there's grafts. You can use it for minor scrapes and scratches, but it shines when you're using it for full thickness in those hard to heal wound beds. If you have patients who have any type of dermatosis where you have somebody who has shingles or radiation recall and you need a topical aspect, that's where the antimicrobial hydrogel would shine in your wound care practice. You know, we always talk about products and if there's any contraindication. And the good thing with hypochlorous and Puracyn Plus is that there is no known drug or treatment contraindication. It plays nice with others. It can be used with additional modalities like negative pressure, mist therapy, pulse lavage. It's safe to be used in the hyperbaric chamber as well. So the do no harm process of Puracyn Plus and the contraindications are there. I do want to mention the storage requirements for hypochlorous. That molecule, although it's aggressive, is a very fragile and fickle molecule outside of the body. It doesn't like a lot of things. It doesn't like certain plastics. It doesn't like too much heat or sunlight. And so our bottles are specifically designed to keep our molecule stable and active. And so we don't recommend that you put this in any other bottle except for ours, that you keep it out of direct sunlight because that molecule is fragile when it comes in contact with lights and stuff, that you store it appropriately. I do want to share some case studies with you though. We, again, use our products in many different capacities. This is a safe product that can be used in the pediatric or neonate arena. And so when you have patients who are pediatric and products that are currently on the market can sting or burn and scare, we incorporate Puracyn Plus, which doesn't have a sting or a burn. And with this particular patient, they had a decrease in the amount of redness, the pain threshold, and the scarring. But when you deal with something that's a partial type of wound bed to even a full thickness wound bed for limb salvage, this is one of our patients that we came in contact with that was actually up for grabs for an amputation. And after looking at the wound bed and the good blood flow, and prepping the bed correctly with daily soaks of hypochlorous, incorporating compression where it needed to be, and patient compliance. We actually saved this limb with just by utilizing a product for wound bed prep. After learning about hypochlorous in a very broad way, do you see a value in bringing it into your practice? We're always looking for posters and studies, getting people familiar with utilizing hypochlorous and utilizing a system of addressing wound bed prep and the barriers to healing. Would you guys be interested in doing a poster or study? So I want to spend our next 10 minutes in just doing some question and answers with you guys. We've had just a small snapshot of what hypochlorous is and where you can incorporate it, and we wanted to leave enough time for you guys to have questions. This is not just a standard wound product or a wound cleanser. It can impact and be another product that you have in your arsenal as far as cleansing and prepping the bed. So let's start with some questions.
Michelle, thank you so much for that presentation. As Michelle just mentioned, we're now opening the floor up to questions. If you have a question for Michelle related to today's program or Puracyn or hypochlorous acid, please submit your question using the Q&A app found on your console. We'll try to get through as many as we can in the next 10 minutes. So Michelle, for our first question, what makes Puracyn different than other hypochlorous acid solutions?
So that's a great question. We get that quite a bit. We have competitors in the space, and the difference is hypochlorous is hypochlorous. So our manufacturer competition that is truly a hypochlorous-based product, our hypochlorous is the same as their hypochlorous. I guess the difference would be the breadth of products that we have and how we get it to the patient as far as just the different configurations. The stability of our product and how long our hypochlorous molecule stabilizes in our product and remains active. And some of our competition do not have an antimicrobial hydrogel. But I do want to press that hypochlorous is hypochlorous throughout the industry, and it's really getting to get to the end user to just be comfortable in utilizing hypochlorous. And for me, I want you to use Puracyn, but I would really much rather you just believe in the hypochlorous molecule. And if it means it's another product that you bring onto the shelf, as long as you actually accept hypochlorous and what it does to the wound bed, I'm happy.
Thank you for that answer. Is hypochlorous effective for treating biofilms? And what is the lowest percentage solution that is effective against biofilms?
So I'll tell you with hypochlorous and biofilm, well, with biofilm in general, when biofilm is in the gummy state, when it's pliable, a lot of things can help remove it. Hypochlorous can, and an aggressive type of cleansing can. When it gets to a hardened biofilm in a wound bed, a lot of times those liquid-based products can't break that up. There has to be some type of debridement, whether it is a mechanical type of debridement, a sharp debridement, or those more specific products that are geared to a biofilm removal. In a gummy nature, a lot of liquids can remove off. I will say though, with hypochlorous, and with our products, with hypochlorous, our parts per million is 240 parts per million. And the difference between us and a competitor is, give or take a few parts per million. But the hypochlorous molecule, as it starts to flush through with wound exudate and whatever, and it starts to decrease, hypochlorous can stay active and aggressive all the way down to 10 parts per million. So as exudate starts to kind of dilute hypochlorous as the day goes on or what have you, it's still staying active and aggressive all the way down to 10 parts per million. And with that, you're still removing that gummy nature of some barriers to healing or a bioburden in the bed.
Okay, thank you. Could you talk more about wound bed preparation and how hypochlorous acid can assist with that?
Sure. So with wound bed prep, we're looking at what barriers are in the way of the wound from progressing. And a lot of times we see barriers to that as necrotic and slough tissue, infection, high inflammation, or stuck in the inflammatory response of the way wounds heal off. Moisture balance, we all know wounds don't heal when they're too wet and they don't heal when they're too dry. So you're trying to find that moist wound balance so that the wound progresses. And also you could have some issues with your epithelial edge migrating across. And so with hypochlorous, whether it's liquid or gel, we want to make sure that we are addressing as many barriers to healing so that the wound is prepared to take on those more advanced products. The challenge, I guess, that I have in our industry is because wound cleansing is sometimes an overlooked step, we get those more advanced products and they're not doing what you anticipate them to do. They're not doing what the manufacturer is saying that it will do. And really, it's not the product's not working. It's just the bed hasn't been prepared correctly. So for us, we always try to get clinicians back to wound bed prep as being a really important part of the healing process and making sure that we removed as many barriers to healing as possible. And with Hypochlorous and Puracyn Plus, we address a lot of those needs with debridement as far as removing necrotic and slough tissue. We have a debridement indication. Moisture balance. Our hydrogel will donate moisture to that wound bed. Hypochlorous itself as far as removing a bioburden in the bed, and just making sure that the bed has been prepared correctly so that you can add those more advanced products to get that healing rate as fast as possible.
Thank you, Michelle. We have some questions here. Can Puracyn be used with non-adherent dressing?
So yeah, Puracyn can be used with any type of dressing. Non-adherent, you're still going to have to create whatever dressing on top of it to keep it in place. So if the primary is cleansing the wound bed or applying moisture to it with a hydrogel and you're putting a non-adherent dressing over it, that's totally fine. But you still have to adhere your dressing to your patient, whether it's tape or you're tacking it down with a Curlex or what have you. You're still going to have some type of product to keep it in line with your patient. But as far as hypochlorous with a gauze or hypochlorous with, say, a Telfa, they interact very, very well with each other.
While we're talking about dressings, can you pack a wound with Puracyn in the same way you would use gauze and saline?
You absolutely can. You can saturate gauze with Puracyn, and then you would put it into the wound bed. And again, just as a reminder, unless it's for debridement use only, doing a wet to dry is not what the direction is. Using it wet to moist. So you can saturate gauze with either the liquid. If you have a drier wound bed, you can actually saturate the gauze with the hydrogel, and you can pack with it. And you want to, again, remember that you're keeping it as a wet to moist. Wet to dries are for debridement use only.
Thank you. And is Puracyn safe to use on patients undergoing hyperbaric treatment?
So yeah, it is. It's safe to be used in the dive, as they say. I want you all to remember that Puracyn and hypochlorous has a safety profile of saline. So anywhere that you would incorporate saline, you need to be confident that you can use the hypochlorous in that same capacity. So yes, it is totally appropriate to use it in hyperbaric, and we do it all the time. So it is absolutely safe to do that.
Great, thank you, Michelle. That's all the time we have for today's webinar, and I want to thank you all for all of your questions. This is just a reminder that we have included a link to additional product resources under the document icon. Please be sure to review these resources at your convenience. You may also visit the Puracyn product page on woundsource.com for more information on this product. This webinar has been recorded and will be made available in full on demand after the program. Please look for our follow-up email that will alert you when the on-demand recording is available so that you can review any material you missed or simply go over the program again. Also, you will be redirected momentarily to a brief survey. We appreciate your participation in this questionnaire as you leave the program. I would like to extend a warm thank you to Innovacyn for sponsoring today's program. On behalf of Michelle Moore, as well as the teams at WoundSource and Innovacyn, thank you for joining us and for taking the time to view this webinar. Have a wonderful day.